Hi, I'm Ashley James with Good Morning Maryland. Thank you so much for joining us for our July Facebook Live with GBMC HealthCare. Today we are talking about summer eye health, and it's a topic that's been getting a lot of traction online, and I'm joined by Dr. Tanvi Shah, Comprehensive Ophthalmologist and Cataract Surgeon at GBMC HealthCare. So thanks so much for joining us.
Thank you for the invite.
Yeah, of course. We've met before where I remember working on a story with you, and so I'm really excited to get a chance to chat again. So we had a ton of questions come in, and just to remind you, if you haven't joined us before here on Facebook Live, this is your opportunity to talk to Dr. Shah, to ask her all the questions you have about eye health. That's why she's here. And we had a lot of questions that were submitted earlier, so I want to jump right into those, but jump online, ask your questions. This is the time to do it. Okay, so we had a ton of questions. I want to start with one sort of general one, asking what are the most common eye conditions out there?
So in my office, many patients come in with dry eyes, cataracts, or just a routine eye exam looking for glaucoma, macular degeneration, any sorts of eye diseases that they have a family history of.
So are most eye diseases genetics, they run in the family?
Some tend to run in families, some tend to happen with age, and some happen just 'cause.
Just 'cause. All right, so since we're talking that some can happen just 'cause, a lot of people get really nervous in the summer. We pay attention to putting our sunscreen on and taking care of our skin. We know that that's so important in the summer, but our eyes are really important. A lot of times we forget about them. So Bridget wrote in, she says, I have blue eyes and the sun, even with my polarized sunglasses, still it's too bright. Should I buy new sunglasses? If so, how often should my sunglasses be replaced?
So we think of sunglasses as sunscreen for the eye. So you want to make sure you get a broad spectrum sunscreen. So sunglasses UVA, UVB protected. They'll say UV 400 or 100% UV protection. That's key. Glare-wise, polarized is nice. So that's going to help you with the driving, the glare off the water, things like that. But they're not actually protecting your eyes from the UV damage that can occur. And in terms of how often, basically as long as the glasses wrap around your eyes, they cover your eye area, they cover the skin around your eyes where you might get UV exposure and stuff, you should be okay. If the coating is peeling, the lenses are scratched, if they're chipped, that's a good indication, like any pair of glasses. Time to update them.
Time to get a new one. All right, William, hello. Thanks for joining us on Facebook. To go off that question, when should kids, how young should we start putting sunglasses on our kids? Is this all ages?
Yes, all ages, because again, like sunscreen and UV exposure, children are actually out a lot more than we are. So they're getting a lot more UV exposure than the grown-ups are.
Okay, well, that makes sense. Okay, another question that we had was, what is the difference between UVA and UVB when you're outside?
So there's three types of UV light there's many types, but the three main types are UVC, UVB, and UVA. UVC is filtered by the ozone, so UVB and UVA lights are what reaches our body. UVB light is the one that's known for tanning and sunburn. So that's where the sunglasses will help with that too. And UVB light is actually what causes, the snow blindness or the photokeratitis that we will see from bright lights, because that's where it's absorbed is the cornea, the front surface of the eye. Patients that have those growths on the eye, known as pterygiums or pinguecula, that's from UVB.
Okay, gotcha. Another question that came in was, should sunglasses say 100% UVA, UVB protection?
They may not say 100% UVA, UVB, but they should say 100% UV or UV 400 referring to the wavelength frequency of the UV lights that we want to block. Or they will say UVA, UVB blocking. But yes, they should have some sort of indication as to what percentage or what they're blocking, yeah.
We had a couple questions coming in on Facebook right now. Ruth asked, they said I have bleeding behind my eye due to diabetes. Should I stay out of bright lights?
So if you're diabetic and have bleeding behind the eye, that's usually related to diabetic retinopathy, and you do need a full comprehensive eye exam. Sun damage is actually not linked to diabetic retinopathy directly. Type blood pressure, blood sugar, cholesterol control, like your primary care doctor was talking about, is what's highly associated with diabetic retinopathy and bleeding in the eye.
Okay, Shanta says, the lights bother my eyes. I am on plaque. Which type of sunglasses should I buy?
I'm sorry, she's on...
She's on, it says plaque, P-L-A-Q-U-E.
I'm
So I
not
don't
sure
know
what
if that's on. Okay, so Shanta, maybe if you could be a little more specific in your question, we can try to get that answered for you. But if the lights bother your eyes,
Again, polarized sunglasses, if it's glare that's bothering you, if it's just sun protection, you're looking for UV protection, the UVA, UVB blocking.
okay. Kathleen just wrote in, I have dry eye disease. Does the sun agitate it more?
In general, dry eye disease is very common. We all get dryness from hormones, medications, reading, tablet use, driving, low humidity air conditioning, ceiling fans. Sun can be drying too, but the sun in particular will cause some glare if you have dryness because the front surface of your eye isn't smooth. I say it's more like a cracked windshield, lumpy, bumpy, so the light isn't hitting it directly smoothly. Lubrication, artificial tears, over the counter, as needed. I suggest when you're dry like skin and dehydration, do it a lot at the beginning. As you feel better, taper off slowly. If you're dehydrated or dry skin, can't just stop the lotion once you feel better because it all comes back.
Now, speaking of the eye drops, I have heard so many people say that they just can't do them or they are too scared to do it. Is that something you hear a lot in your practice?
We do.
Yeah, I mean, it seems so simple, right? But for
It's
people,
not.
it can be scary. Yeah.
Well, I mean, there's something coming at your eye. You're
Right.
really naturally going to blink. It takes practice. Honestly, I tell patients lots and lots of practice. The other thing that I'll tell patients, if it's not, if your skin is clean, if everything is, a nice area, you can actually close your eyes, tip your head back, put it right there between your nose and your eyelid. When you open your eyelid, it should dribble in. But if you're wearing makeup and sunscreen, that's also going to be getting into your eye, which is not the way to do it then.
Gotcha. All right, Shanta wrote us back. So she said she's on a medication called plaque for lupus. So this might be a very specific question that maybe should go to her doctor. But so in asking it again, so she's on that medication. The lights bother her eyes. Is there a type of sunglass that you would recommend?
So one of the common medications for lupus is actually Plaquenil. So maybe she's on Plaquenil.
Okay.
That is not related to light sensitivity and toxicity at all. Plaquenil is caused retinopathy in the back of the eye, so that's a different exam completely. She's probably just sensitive to the light from the bright lights and regular sunglasses with the UV protection again.
Gotcha.
Maybe polarized if the glare is getting to them.
Okay. Ruth asked, what causes, let's see if I can, okay, what causes visual light shows?
Many things can cause visual light shows. It can be as simple as an ocular migraine or an aura before a migraine. It can be a sign of something more dangerous in the eye, like a retinal detachment or a retinal tear. It could be something as simple as a floater. Again, if you're having light shows, a full, complete eye exam, a medical eye exam is indicated.
Some more questions that we got a little earlier.
Yes.
What are cataracts? So we hear that term a lot, but what does it mean?
So cataracts are a normal finding in my world. I tell my patients they're very similar to gray hairs and wrinkles in my world. They're a normal aging phenomenon. So it's the lens that we're born with getting stiff with age and then cloudy. When it gets cloudy enough that patients can't see well to do the activities they enjoy doing, even with a pair of glasses, I'll consider surgery. Up until then, I tell patients, this is part of life. UV light does make cataracts possibly worse. There is an association from a study done at the Chesapeake Bay through WMAR, where they had fishermen wearing sunglasses and broad hats who felt that their cataracts progressed less quickly than the fishermen that didn't. However, it's not a direct correlation. There's an association.
Are cataracts common? This is very...
Yep. Gray hairs and wrinkles. Everybody's going to get them with
Okay.
birthdays. Yep.
All right. So another question that just came in on Facebook, what can be done about floaters?
So most of the time floaters are benign, meaning there's nothing to do about them. We usually watch them. But if they're nuanced, again, we'd want to be examined to look for a retinal tear or retinal detachment. You can have surgery to remove floaters. However, it's not usually indicated. If it's a normal aging floater, a vitreous separation or a floater in the jelly of our eye, we tend to tell patients try to look past it, try to ignore it, as long as you've been examined and made sure that there's nothing else causing the floater.
Okay, gotcha. Going back to cataracts, and you may have mentioned this, but we had another question just in case I didn't catch it. What can you do to treat cataracts?
There's nothing to do to treat cataracts. Once again, when they're visually significant, we'll consider surgery. To prevent the growth of cataracts, just wearing some sunglasses, UV protection.
Gotcha. Okay, what are signs and symptoms of a serious eye condition? When should you say, okay, I think it's time for me to get to a doctor?
When things just aren't quote unquote normal floaters, flashes of lights, can't see clearly, eye pain. And many eye diseases don't have signs and symptoms. An early cataract won't, early glaucoma won't, early diabetic retinopathy won't, macular degeneration early won't. So the American Academy of Ophthalmology actually recommends routine eye exams starting at the age of 40. Sooner if you have a family history of any diseases.
Okay, so that's a once a year?
Start it once a year,
Okay.
see what we see, and then the doctor will decide with you if you need it more frequently, or is once a year, once every 2 years all you need.
Okay, very good. Let's see, another question coming in on Facebook. If they say you have 20/20 vision, then why do you need reading glasses? I cannot read small letters.
20/20 vision is measured at distance. Near vision, which we measure separately, and as we get older and that lens in our eye, that cataract starts to form and stiffen. It's called presbyopia, and we start needing reading glasses. There are patients that are naturally nearsighted who can't see far away and can't see 20/20, who can continue to read lifelong without reading glasses, but they've already lost their distance
Okay.
vision. So, yeah.
All right, so there you go. Another question from Facebook. How serious is dry eye?
It can be very serious, and it can be just mild, again, depending on the severity of it. Treatment could be just simple as tears or prescription medication. Dry eyes can lead to corneal abrasions and infections, so it can be a very serious condition.
Okay, and can you explain what dry eyes are again and then how you can treat them?
So dry eyes have tears, water, mucus, oil that makes up our tear component of our eyes. When you're missing or imbalanced on any of those three components, our eyes are usually not comfortable. Most patients will complain of a foreign body sensation. I feel like I got something in my eye. There's an eyelash in my eye. There's sand in my eye. Other patients say I have to blink a bunch of times to focus, and then it's really clear, but then I keep reading and it gets blurry. Dryness can also be from medications and other hormonal changes. So dryness is the imbalance in our tear quality.
I can imagine how frustrating that would be for a patient. I mean, if you haven't experienced it, you're just thinking,
Yeah.
oh, that, just the thought of having something in your eye can make you feel crazy, right? You're in the bathroom opening your eye.
Absolutely,
Like,
absolutely.
okay, Antoinette says, unlike having dry eye, I have watery eyes. It's not allergies to the point my eyes see blurry.
So watering can actually be a sign of dryness sometimes, and sometimes it can be the tear duct being plugged. So I tell people it's like a kitchen sink. You have glands that produce tears, your faucet. You have one gland in each eyelid, your nasolacrimal duct, that drains the tears out. If you are dry and not producing enough tears, your body is uncomfortable, it's not happy. It turns on the faucet full blast. It doesn't know how to titrate, medium, low, high, how much tears you need. If your drainage device, the sink, is plugged, then the tears have nowhere to go that the body naturally produces, and they'll dribble down. So it could be either overproduction or plugging of the kitchen sink.
Okay. And just wanted to let you know, Ruth, who asked a few questions on here, said you are amazing, so thank you so much.
Oh, thank you, Ruth. That was very sweet.
Another question, Glenda is asking on Facebook, what food or vitamins are best for sight?
So there isn't a specific vitamin. They are the AREDS eye vitamins out there that are shown to help with intermediate macular degeneration, but they're not necessarily shown to do much for overall routine eye health. We do recommend just a healthy diet, balanced diet, green leafy vegetables, zinc, vitamin C, vitamin E. Again, just a lutein, a balanced, well-nutritious diet with citrus, fruits, green leafy vegetables.
Okay. Good, good information there. Matt wrote in, and I know I'm going to butcher this word, so you'll have to help me out. My daughter has coloboma in her right pupil. Does she have a higher chance of eye damage from sunlight?
Depending on where the coloboma is, how large it is, if more UV light is getting into her eye, possibly. But that would be a great question to ask her ophthalmologist or her eye physician.
Okay. Speaking of the type of work you do, so can you tell us the difference between an ophthalmologist and the different eye doctors that are out there?
However, optometrists can treat many medical diseases. It is state dependent what they can and can't treat. Now, when you go to get your glasses, you're meeting the optician who's going to measure you, talk to you about your frames, talk to you about which lenses are right for you, tell you the different options and coatings and lines, no lines, bifocals, tint, no tint, all that stuff. That's, really where the optician comes in and helps us out.
So starting from the beginning, when you're 40 and you go to get that annual exam, who are you going to?
Either an optometrist or an ophthalmologist, depending on your preference and your need. If you have a high family history of a medical surgical issue, lean towards the ophthalmologist. If you just need a routine eye exam, I feel an optometrist would be wonderful.
Okay, perfect. Thank you. Another question on Facebook, is it true tea bags are really helpful for your eyes?
Not that I know of, not that I have
Okay.
heard of, yeah.
Just an old wives' tale, maybe. Or
Maybe.
maybe the cucumbers on your own.
Yeah.
They're just all for fun, I guess. Okay, so let's see. Are mirrored sunglasses more effective than others?
In terms of UV blocking, no. In terms of, they don't do any UV blocking mirrored glasses. They're more cosmetic for glare and rebounding of the light and how dark you like your tint.
Okay. We have some very specific questions coming in, but I'll try them anyway on you. So
Sure.
Lisa says, I was always considered legally blind. I have chronic dry eye. I've had plugs. I've also had cataract surgery. I hate that I did that even with my past. I could pull reading close. Now I have to use a flashlight and hold a little sideways. What do you think it is?
Yeah, it needs a full exam
needs a
to
full
be
exam, yeah.
able to tell what that would be, correct.
Okay. Another, this is specific too. I suffered a traumatic brain injury 2 years ago. I still have some minor symptoms, but my light sensitivity is pretty bad. What do you think?
That may be secondary to the brain injury. It could be secondary to the eyes. Again, a full exam would give better information, or talking to their neurologists, their surgeons, and their eye doctors.
And is that something you have to get a referral to go get this full exam, or you can just call?
It depends on your, if you're doing a medical exam and you're trying to bill it under your medical insurance. If your medical insurance requires you to get a referral to see a subspecialist or any specialist like a cardiologist or a neurologist, we fall in that category.
Gotcha.
If you're coming under your vision plan and you're paying for vision insurance, that's a whole nother game. And you want to make sure if you're seeing an ophthalmologist that they do take your vision plan and that they're part of your network.
So you do surgery. What is the most common type of surgery that you perform?
The only surgery I perform is cataract surgery.
The only type is cataract surgery. And what is recovery like for that?
So cataract surgery with me is an outpatient surgery. The surgery itself takes, I tell patients, about 20 minutes. And, you know, I tell them you're going to be seen 1 day after surgery for a pressure check, 1 week after surgery to check your vision, and then 4 to 6 weeks after the surgery is completed, we can look for a pair of glasses. We always do one eye first, or at least I should say I always do one eye first, the second eye following once the first eye is healed. They run eye drops for about a month, no heavy lifting for 2 weeks, no water in the eye, pools, hot tub saunas for 2 weeks. It's not a strenuous recovery, but it's still surgery.
Right.
And there's still risks to every surgery, so we want to play it cautious, but they can go back to work, assuming they don't do any heavy lifting, no water, they can go back to work the next day if they're comfortable.
Yeah. If you've had a lot of eye problems in the past, I know people, you know, a lot of people like the contacts and want to stick with them. Is that, how do doctors and specialists feel about contacts? Is that okay?
I love my contacts.
You have them, okay, great.
I have them in. I personally don't do contact lens exams. We have a lovely optometrist at GBMC who helps us with our contact lens exams. It got to be, you know, I wanted to focus more on the medical aspect of my career. But as long as you're clean hands, good contact lens hygiene, I tell patients, you're putting a foreign object inside your eye. Sleeping in them, showering in them, no-nos, right? You got to follow the instructions. Over-wearing them, wearing someone else's contact lenses, not good ideas.
Right, not good at all. Okay, another question on Facebook. Do you recommend eye lift for top-heavy lids?
It depends on what's causing the top-heavy lids. Sometimes it can be functional, meaning it's covered by medical insurance if they're droopy enough. If it's a cosmetic procedure and it's not going to exacerbate your dryness or any other underlying conditions, it can be a great surgery. Sometimes if you already have underlying dryness and it's borderline, you can make it worse, and all of a sudden now you're unhappy, and it probably wasn't worth it. But every patient's individualized.
Yeah, still getting a lot of questions about the glasses and sunglasses.
Sure.
Expensive or cheap? Does it matter? Can you buy a pair of cheap glasses and still?
UV blocking, that is the key. UV blocking sunglasses, whether they're expensive or cheap, isn't, you know, a big deal. It's more that you need the UV block, and then again, like I said before, glare, polarized, but that doesn't change the eye health. That's a comfort issue. So any glasses that have a UVA, UVB, 100%, UV 400, etc. Something to that level.
Right. Well,
is
that's
what
good
you
to know,
need.
because I think you always think, oh, they must be better because they're $200 versus, you know, 40.
I know. They're probably just cuter.
Right, exactly. Question on Facebook. Caitlin asks, is it possible for your eyes to get better over time? I've worn glasses my whole life, and I no longer need them for reading.
Yes, welcome to cataracts. We call it second sight sometimes. As the lens is shifting, changing, growing, I guess I should say, your prescription will change. Many patients will say, I used to not be able to read, now I can read again. But now they can't see far away. Or I used to be able to see far away and now I can't, but I can, get this again.
Yeah.
It shifts. Some people get better vision, some people get worse vision. Better and worse is in the eye of the patient, right?
Yeah, of course. So that's interesting. Okay,
Yeah.
well, that's good to know that it could get better. Okay, any questions that, you hear in your office a lot that, we didn't get a chance to ask today that maybe, this is your time?
One thing I would highly encourage patients to do is just get a routine eye exam. Glaucoma, macular degeneration, diabetes, a lot of these don't have early signs and symptoms. Lots of times they're just picked up on routine eye care. I just came in for an eye exam. And then the other thing is, in my world, it's just nice if you know if it's medical or vision so that we can help you get the eye care that you need. And the bill, it's always a big deal. If you come in under your vision plan, we can't do a medical workup.
Gotcha.
So things like that.
Okay, well, good information. One last question.
Yes.
Are fake eyelashes bad? We just, someone asked.
So I have had a few patients have an allergic reaction to
Really?
them.
Okay.
You've got to be careful. Again, it's a foreign object. There's glue, there's bacteria. They don't, fake lashes, generally you don't take them off.
Right.
They stay on for a while. So you've got to be careful, as with anything.
Right.
And some patients do want, again, I probably only see the unhappy patients.
Right.
I tell that to my patients. I don't generally see the happy patients because they're not going to be coming in and telling me that their fake lashes caused a problem.
Right,
So
but there is a risk. Okay. All right. Well, great information. Thank you so much for joining us. And how can people get in touch with you in your practice?
So gbmc.org/ophthalmology, and I'm sure it's posted on the Facebook, our contact information.
Yes, it is. All right. Well, thank you so much for being with us. This was great information. We had so many people on Facebook, so thank you for joining us today. And we will see you back here next month. Have a great day.